Hyperlipidemia. Ever heard of it? Well, maybe you haven't heard that exact phrase, but you probably know what I'm talking about. The meaning of the word hyperlipidemia breaks down to abnormal excess and lipids. Then, lipid is an umbrella term for various molecules in the blood, specifically cholesterol and triglycerides. So, when we're talking about hyperlipidemia, we're talking about abnormally excessive levels of cholesterol and triglycerides in the bloodstream.
Normal lipids means in general for society a cholesterol, total cholesterol, say about 200 or less. Now cholesterol comes more from saturated fat, that's beef and dairy, as opposed to triglycerides, which are more from sugar and sweets. And triglycerides have a little stricter standards, about 150 or less is considered normal. Now the trouble is in westernized society, normal average is more like 220 cholesterol in America, and we feel normal is below 200. So the average person in westernized society in America actually may be above, quote, normal, and the average person may be at some risk of vascular disease because they have some modest level of hyperlipidemia.
The vascular disease linked to hyperlipidemia is atherosclerosis, or hardening of the arteries, which in turn is the common culprit behind cardiovascular traumas like stroke and heart attack. When doctors detect hyperlipidemia in patients, it's like finding a pre-heart attack. No, it doesn't mean that you're going to have one, but it doesn't hurt to start doing everything we can to keep it from leading to that.
It has to do with the modern lifestyle that we have. So inactivity and poor diet contributes very significantly to this hyperlipidemia. So you can try to do that yourself by exercising 20-30 minutes a day, a modest walk, by modestly improving diet, by trying to cut back on saturated fats, a little less beef, a little less dairy. You don't necessarily have to be a vegetarian, but modest cutbacks in diet, modest daily exercise, which could mean a 20-30 minute walk. It does not necessarily mean having to run the New York Marathon. Modest, realistic exercise with modest improvements in diet and modest weight loss can drastically reduce risk, and will almost always initially try to improve lifestyle before going on to medication.
The most common medications used for correcting high lipids are called statin medications.
A Nobel Prize was won years ago for the basic understanding of the chemistry of how the liver controls cholesterol and how to interfere with the production of cholesterol in the body. And so by interfering with cholesterol production through the liver, these statin medications can help safely and dramatically lower cholesterol, not just to make the numbers prettier, but to lower vascular events. And in the past 2 decades or so, we've been in a revolution of preventing atherosclerosis, of lowering heart attack risk, of lowering stroke risk, and a lot of it has to do with the more aggressive and safe treatment of lipids. And a lot of that has to do with the introduction of these statin medications.
Statin medications, or statins, are usually taken once a day, and though they can be taken at any time of day, they may be slightly more effective taken before bedtime. For people who have a genetic predisposition to hyperlipidemia, statins may be something they always have to take. For others, it might just be a bump in the road to good health.
Many people, it is lifestyle related. And so if you're on the cholesterol medication and a year or 2 later you're able to improve your lifestyle, you really get motivated to go to the gym, you start some sort of realistic, safe diet, and then your weight comes down and you're exercising more, then by all means you can cut back the dose, you can try stopping it, check out 3-4 months later how are my numbers doing, and give it a second chance without medication. That's absolutely reasonable. I would try to do it under physician supervision so we have a sense of where are the numbers going.
You can try to prevent hyperlipidemia by exercising and really watching your diet. Unfortunately, some hyperlipidemia is tied to genetics, and preventing it altogether is impossible for everyone. But it never hurts to fill up on vegetables or squeeze in a walk in the evening. Maybe you won't lower your cholesterol levels, but you'll feel good trying. I'm Dr. Mike Rosen, and you're watching the eHealth Network. Stay healthy.